Michael Mineo here, October 18th, 2025, and what you're looking at is a medical record, a highly fraudulent medical record. This particular medical record was for an actual appointment, okay? There are quite a few medical records where no appointment occurred at all, but they were done up as if one did. So now let's take a look at this one. But before I go forward, remember this happened in the context that of a person who has been subjected to a assertive community treatment, okay? And so they actually are legally being gang stalked at this point because you have a multi-specialty team, okay, comprising of different specialists. Of course, it's going to include a psychologist or psychiatrist, right? So you got the multi-specialty team, which includes a behavioral analyst and a person that coordinates and directs. And the real director, however, would be the psychiatrist or psychologist on that team. And they're following, you see, a treatment plan that was never presented to the patient here on this record because the treatment plan was fundamentally to never treat this patient correctly ever again. Okay, but what I mean by that is that they would not treat you for what you're presenting. And plus, there's a psychiatric file that goes along with this medical record. Okay, so you're looking at a medical record, but there's a psychiatric record because they're working a dual situation. Okay, it's behavioral medicine, right? And of course, I had no idea of that. I had a problem. I was presenting at that time a tongue that had fissures. In other words, definite, like what looked like cuts. Okay. And of course, there were other problems. And it had been going on a while because this was not my first attempt to be treated. I initially contracted CANDIDA, okay, in October 20th, 2012. Now, there were several appointments, 4, between the infection point and this medical record here on March 15, 2013. Now, to make things worse, no labs were done the previous 4 appointments. The first appointment in, I think it was October 30th of 2012, a physician's assistant who is mentioned here actually is, I think, Don, as if we had a conversation. Yeah, Don. And based on a sore throat complaint, gave Omnicef, an antibiotic, without doing a lab. So what occurred is 8 days later, I go back, nothing. He looks at my mouth, nothing. He still doesn't do a lab. Now, of course, you know, I'm brushing my teeth, brushing my tongue, gargling constantly because this stuff is bugging the crap out of me, right? And it's getting worse. So I go back a third time, but this time I have photos. I got 10 photos. The guy walks into the office at Care Medica, North Haven, and he walks and he sees the pictures and he goes, "What's that?" And I go, "Well, that's pictures of of samples I've been spitting out of my mouth." And you know, when he said, "What's that?" He was very dramatic. I mean, he jumped back like, "Whoa, what's that?" Okay. And what does he do when I say it's photos of samples that I've been spitting out of my mouth? He walks out to the doorway, turns around and goes, "You're crazy," and leaves. Okay? Leaves. So 3 appointments with this guy, nothing. Then what happens? I make an appointment to see my HIV doc. I was like, this is crazy, right? I can't get in there to see him for a couple of weeks. In the meantime, the guy put on the drama act and then the crazy and whatever, and I went untreated, and I had this problem that was driving me crazy, right? Well, what happens the fourth visit over there with, good old doc. Same stuff. No treatment. I had the pictures. I said, gee, these are scary. It's pretty ugly. Scary looking pictures. And I asked the question. I go, this isn't Morgellons, is it? And he said, no, he just was like, oh, you're being a little crazy. He says, oh, we're being, I guess exposed to things in our environment or whatever. But did he do a lab? Did he do a swab? No. He put down my medical record. Mike was perfectly fine. Perfectly fine. And the medical record was signed like 40 days later in January, because the appointment happened December 19th of 2012, and it was signed 40 days later. And of course I had delusional parasitosis, basically, okay? Because I asked the question and I had the photos, I was given an assessment there, which is like a delusional mental illness. And there's nothing delusional about it. You got fissures on your tongue. You took photos of samples by doing a red wine swish with a little hydrogen peroxide to draw the stuff out. It grows in that environment. You take photos of it, and I put videos up of it. And at the time, it was scary looking stuff. But hey, it's Candida. It's two forms of Candida. Number one, because you can see the greenish Candida is actually not your standard Candida. It's called Candida dubliniensis. I can't even pronounce it. It's like dubliniensis. Okay, there you go. And it's not typical. And you need a different medication to treat it. Okay? So I just wanted to give you the background. I had no treatment. Okay? I was called, you're crazy. Walked out because I brought photos. Okay? And it doesn't make someone crazy because they bring in sample photos that they've taken, samples, actual specimens from their mouth. It's crazy to call somebody crazy. Okay? But these people were already working a narrative. Matter of fact, I had already been given a delusional mental illness, psychiatric disability without my knowledge, a fact or an act, an assertive community treatment, okay, was just rammed through behind my back, no due process, no chance to review evidence, witnesses if there are any, an attorney would be nice. Okay? Nothing. With the program I was in, typically the person is involved in the development of their treatment plan, and those involved in their treatment, in other words, it's not a total secret. And every periodically look at the plan, look at their progress, and go forward. None of that ever happened. To this day, I know what the treatment plan is because I've done 8 years, okay, of engaging this system and investigating records and whatever, okay? I know your MO, I know your SOP. It is something else. So I wanted to give you that background. 4 visits. And I had been sick already since about October 20th, 2012. And here we are, March 15th. A little more background here before we go. 3 days after this appointment, because the condition was driving me so crazy that my significant other suggested going to the ER. Okay, and just saying, well, maybe they'll find something. So what occurred is when we went to the ER, was I was given a provisional diagnosis of Candida and given oh God, what was the prescription? It was an oral prescription. In other words, one that you spit, You swish in your mouth, you spit, okay? It was your, I can't remember off the top of my tongue here, but it was the wrong medication. No lab was done. And of course, you know, they made it clear that, oh, you know, I seemed to be in good spirits. I was in a good mood. I was in no distress and all this other. In other words, I waltzed in there just happy. Basically, not as somebody who'd been trying to get treated since October 30th, 2012, and it was March 18th, 2013. And that was the first prescription I got. First antifungal on March 18th. It was the wrong one with no lab. It didn't do any good for the Candida dubliniensis. Okay? None. Only your regular Candida is all it would treat. It wasn't going to help the tongue. It wasn't going to treat my problems. Okay? And of course, that's what they wanted. They wanted me to continue to complain and continue to go back and back and back. And, you know, it didn't matter where I went. I was going back to the same place, being managed by a multi-specialty psychiatric team that I had no idea existed, executing a plan I didn't exist, based on a comprehensive assessment that, by the way, I would just love to read, okay? All right, you guys got to write a nice story, didn't you? And then you rammed everything through and you just spread your story all over the frickin' place, okay? Unopposed. I mean, what country do I live in? Just asking. So let us take a look at this wonderful medical record. That, by the way, I don't blame Rebecca Grill. I don't have ill feelings towards her. You know, I don't want to like sue her and all that. And remember, it's because she was following a directed plan as part of a multi-specialty psychiatric team executing a treatment plan. Okay? Now, the reason for the appointment, lesions on tongue, red and painful, is not what I represented. History of present illness. This gets really good. 54-year-old male presents with Kira with symptoms of, I guess, general, forget it. I'm going to leave that out. 54-year-old male presents with C/O, general. Patient believes there are toxins being dispersed into the atmosphere and learned of a red wine gargle test that you filtered through a coffee filter. He discussed it with Don. That was the guy that walked out and went, "Ooh, what's that?" And then crazy, you're crazy, right? Failed to treat me for 3 appointments. Failed to do a lab. Failed to, properly diagnose and treat. So this is the thing here. Okay? Where do they get? Patient believes there are toxins being dispersed into the atmosphere. Where did they get that from? My YouTube channel, where I had what? Chemtrail videos and atmospheric manipulation and geoengineering videos. Okay? And I had asked Dr. Goodwin, I think it was October 20th, 2010, at an appointment, could you please do an aluminum test? And he thought I was crazy, right? And he went, "Oh, okay, whatever, Mike." And it came back positive. And he was like, "Well, would you mind coming back in for a second sample? We think it's a contaminated sample." We come back a second time positive again. He didn't put down that 2 labs came back positive for aluminum. No, he just left what he put. Mike was being somewhat paranoid about government activities and, of course, the aerosoling of the skies. So that's where that came from, okay? I just told you. I didn't have a conversation with her about squat. This is the multi-specialty psychiatric team talking to you through the medical record with her name on it. And then he discussed with Don. Don and I discussed nothing because the appointment was 30 seconds long. 30 seconds. Right? I already told you what happened. And then his HIV, I already told you what happened with him too. Now let's go down further. ENT, respiratory. He, C/O, I don't know what that means. Small papules and tongue for more than a year. Now, that's a false statement because I went in, when? October 30th of 2012? How many months ago was that before this appointment? About 5 months? Right. Not a year. And my complaint when I went in was a sore throat, was it not? And they gave me what? Antibiotics without a lab. And then what showed up several weeks later? A really nasty candida infection. Okay? Because I had one before he gave me the antibiotics. And here they're trying to make it sound like papules and tongue for more than a year, false statement, was RX with Omnicet. In other words, I was given Omnicet for that, okay, when it was a sore throat. Matter of fact, I think, and then for thrush, more painful lately because of the tongue and because the candida was making sores in my mouth, okay, eating away, and that's where you got your bacteria inclusions from that were in my photos, okay? Yeah. And then, especially if he is tired, oh man, I'm telling you. I mean, under assessments, you know, they have a very nebulous clinical finding, which means it's like an unspecified kind of a finding for billing purposes, okay? And again, it's really a psychiatric visit that they're billing me for, okay? They consider this a psychiatric visit. That's how they're treating me. And what they do is they do this to a lot of psych patients, I can guarantee you, I'm not going to say every, where they create a record that is just complete insanity compared to who you really are and what you're experiencing. And they do it to reinforce and support their diagnosis, okay? So they're not treating you, they're treating you to keep you as a mental patient and to actually make you worse. There's no question in my mind that with all the abuse, the failure to treat, the gaslighting, incorrect medications, incorrect assessments, and then of course, I mean, basically they're looking to break you. I mean, it's not good for your health, is it? It's not good for anything. So they just screw you around without mercy until you actually are crazy if you're not already. That's the plan. But at least in the medical records, they have specific techniques that they're really good at. They've been trained. Everybody knows them. Okay, it's a standard in the business, and they executed it on me. And I got your number. And when you look at it through a forensic timeline, it is shocking. I don't want to hear some attorney go, oh, you know, something about standard of care. Really? Standard of care. So, the assessments are completely off. Okay? Remember, 3 days later, I got a correct assessment. Likely Candida, and I got a prescription. It was the wrong one. They didn't do a lab. And they did make me seem kind of crazy because the way it was written was like I was just a really happy guy in no distress and just having a good time at the ER. Like I wasn't having a problem for 5-6 months already. Right? Let's go further on this record. Treatment. You'll notice page 1. There's a page 2 here, which we'll get to. But page 1, they're all canceled. Now remember, she handed me a B12 test after telling me she didn't know she couldn't treat me until she knew what was wrong with me in response to my complaints and handed me a B12. To her response, I was like, I'm really sick. Well, I can't treat you right now. So the appointment's over, and on the way out, I get this attitude like, well, if you want, you can talk with Dr. It was a Hispanic name. And it's going to be a really long wait as we're out into the lobby. And in that lobby, I told her, and as a matter of fact, before I did, there was 50 people sitting in that packed lobby, waiting room. And I called out and I said, are you sure you want to do business with these people? And then I looked at her and I went, you people suck. I want to sue you. That's how that appointment ended. But yet, they had all of these lab, CBC, vitamin B12. Well, that was the only part that was true. Thyroid stimulating hormone. Why? For what? I had a CANDIDA complaint. Vitamin D, order canceled. I mean, that's that vitamin D. Are you kidding me? I mean, they want to, really. Then we go to a lab comprehensive metabolic panel. Order canceled. Then we have HIV disease. Now, I had just seen my HIV doctor, right, a few months back. I had another appointment with one, I think, in March later, matter of fact. So it's like lab, CBC. That's what they were doing. So basically, they were treating HIV disease, they were claiming. Not CANDIDA that had really exploded when a lab was not ordered, and I was given Omnicef, okay, on December 30th, 2012, and then received no treatment despite my complaints, despite the symptomology. No, Mike is just fine. No, we need to continue to show Mike to be delusional. Okay, just like we've been trying, just like we got for his psychiatric disability when we went to the probate court, right? We can't have Mike looking sane, coming in and saying my throat, and then getting a proper treatment right out of the gate, 2 weeks, done like it was supposed to. No. Now, HIV disease. Now you can see why, Mike. Why? Because I applied for Social Security disability in August of 2013. Why? This crap. Not getting treated, being allowed to remain sick, allowed to just continue to suffer. Okay? While they're working a dual parallel narrative on me, documenting a psychiatric file while they're while they're completing medical records in a total screwy way. Complete. One, you can't make, most people, if you're an outsider, a stranger, and did not know that there was a team involved, a director, a coordinator, a behavior analyst, and whoever else was involved in my treatment, okay, undisclosed psychiatric treatment, okay, remember I was placed in an involuntary, and it sure as hell is, and with my last dying breath, I'm going to fight this shit, okay? I'm ready to go door to door with you folks, room to room, house to house, block by block, record by record. And you know what? You people are a danger to society. You know what authorized all of this? Mike was imminently dangerous. Imminently. That I could harm another human being. Imminently. They needed to show that to me. You needed to show that to me. You needed to prove it to me. Otherwise, why the railroad job? Okay? Why the railroad job? Just curious. Huh? And it was a railroad job because you folks engaged in what? Parallel construction. You were actually engaging in the construction of a case. How? Connivance, fraud that was authorized because it was so extensive that for all those people to do it, it had to be authorized fraud, and they had to be given an approval and all that stuff. Because I got news for you. Rebecca Grillo would the guy who owns, the CEO of Care Medica, who probably makes $3 or $4 million a year net, okay? Do you think he's going to allow his employees? Oh, I'm going to make sure I get this guy, no. It's all, and that's who I want. I want the people that put together the comprehensive assessment, the people that drove this process. It's an abusive process. Matter of fact, it's a term we've been hearing a lot about lately in the United States, is an abusive process. Well, anyways, this medical record is a bunch of gobbledygook, okay? And you'll notice when you look at it, I should have brought this to your attention. It was printed out on the 11th of 2020. Now, why was this record printed out on 7 years later? As a matter of fact, I had requested medical records, right? Because I knew I had this appointment, but where was it? When I ordered in 2019, these records from Care Medica, twice, they kept sending me out, okay, stopping at 2010. So in other words, there were 3 years where there was nothing at all. And I knew there was at least one visit here or there, okay? So this record, finally, I had to call them up and I had to tell them, look, I know there's records. I gave them the doctor's name. I gave them Omniceth. I used that appointment, as a matter of fact. I gave him the name and the medication prescribed. They were like, oh, let me just check back with you. And then he came back and goes, oh, yeah, okay, we're going to send you out 3 years medical records, right? Right. His name was Ray. Ray at the office there at Care Medica. See, I have a great memory. Ray. Right. So what comes in the mail? It didn't come through Seox, through the normal channels. It came in a folded, regular old letter envelope. Right? And what's in it? It was printed out on the 11th, and it's got electronically signed by Rebecca. So she's still involved in this thing for this office visit. I'm not even a freaking patient, but it's an ongoing case, obviously, or something, right? And then it says sign off status pending. So in other words, it's an open record. Electronically signed on February 11th, 2020, 11:49 a.m. So is that when they made up this whole frickin' shebang? Is she the one who did it? Or did somebody else on the team do it? Or did she do this with the advice of the team? Or maybe just a couple people in the office? I don't know. But I'm not interested in physician's assistants. I'm not interested in doctors, okay? Maybe the guy that, Mr. Petruzziello, who is the top guy, or was, okay? He was the top guy last time I looked. Now, I might want to have this conversation. I want to have conversations with everybody, actually, about what actually happened. I'd love to see them on the stand, actually, and it's tell the truth. The reality is, they were actually participants in the Milgram experiment. Remember the one where if an authority figure gives an order, right, and they'll do it to a subject, and they'll continue to do it even if the treatments are worse and worse, and they can see the person is suffering from the treatments. They still follow the order. Well, I had a lot to say about this one matter. I had a lot to say in general. Okay? All I've got to say is the medical records from the state of Connecticut, they're egregious. Authorized fraud, violation of state and federal statutes, and insurance. Medicaid? A little Medicaid fraud? All this shit's authorized somehow. Right? HRSA funding, the grants, medical case management. Yeah, who was doing medical case management behind my back when I was in Connecticut? Knew nothing of this crap going on. Well, it had to be Middlesex, right? Middlesex Hospital Behavioral Health. Yeah. I also know who did the comprehensive assessment with him fairly close. I'm not sure if it was Harrington. It might have been somebody else. It could have been Navarrete. Remember, These people were not in their current positions back then. They were bucking to be promoted. I've got a problem with you people up there. Hardcore. You caused a lot of problems. You really did. Because your fraud, your connivance ended up with endless bullshit over here in Missouri. And then what happened? Who kept on your narrative and your treatment plan and your secrecy? APO. And what happened? Because everybody wants to know, what's the problem? What's the problem? The problem is they were playing the same game, and I caught them. I already gave, in writing, going back 6-7 years ago. Okay? They were nailed back then. But what your fraud resulted in me not getting proper treatment, and me as a patient, when I tell a doctor something's fucking wrong with me, okay, like I was taking a dangerous medication that was prescribed October 13th, 2015, and I called in, they should have taken me off right then and there, and they didn't. I was on that medication another 18 days, and then I was starting to have a lot of serious problems. Okay? And they've never ended, and they're worse. And it resulted in my complete total physical disability. I'm pretty close to total. And that's been the problem. Because what did APO do? Didn't make a record for the time he called in, right? On October 15th, 2000 and... what date are we talking here? 15? 2015? Right. You didn't make a nurse's visit by phone when you should have. I called back. Okay, on November 4th, another 18 days later, I'm having all kinds of problems. Could you please, I was very nice, and I asked her to get the doctor's permission for me to stop taking that med and to resume the other one and the whole thing. What does the medical record say? Nothing about my symptomology. Nothing about, requesting to be taken, to get the permission, because I didn't want to have a problem with the doc, right? What did the record say? Demanded. Just like I just called and just willy-nilly demanded to come off the medication. Just willy-nilly. Now what did they do the day after? Okay, on November 5th. They created a record from scratch. As if I just waltzed in there for an appointment, and I don't know, I just had a little runny nose, and there was this, little allergy problem, there was whatever, and this, just like bullshit, right? Nothing about the bad reaction to the medication that to this day has totally debilitated me, okay? And so what they've been doing, they created 2 more records after that for appointments that didn't happen, okay? So what do we have? 3 created records, a nurse's visit by phone that should have been created, wasn't, but, there was a prescription order there, right? And guess what? It happened on phone, and we all know phone conversations are captured by multiple things, okay? And with the ARPA, right? Not DARPA, ARPA, HARPA, health, right? That and a few other systems. Guess what? The phone conversations are captured, okay? The state already knows what happened, those 2 nurses' visits by phone. They already know. They already know that what's in the record is false. And then they created 2 more, right? After that. So they created a total of 3 records for appointments that never happened. And they created a nurse's visit by phone that didn't reflect the truth. And a visit that they should have had a nurse's visit by phone, there was none. Okay? And they denied, and tried to sweep all my symptomology under the rug, to continue this mental, delusional bullcrap. Okay? I'm pissed at you fuckers up there in Connecticut. Hardcore! Okay? 10 years of this bullcrap I've gone through, okay, here in the state of Missouri, with them attempting to continue to force your treatment plan on me when I am a debilitated, disabled, medically disabled from the malpractice at APO caused by you fucks up in Connecticut. Excuse my language. I'm pissed at you people like you wouldn't believe. You know how many years of bullshit you've put me through? I want to sue your asses. Every day I think about nothing but suing your asses. Put that in your pipe and smoke it.